forward.
Okay.
So I'm going to quickly just introduce the webinar. Hello, everyone. Welcome to our Nursing Research Interest Group webinar for January 23rd, 2024. We are very excited to welcome Dr. Nancy Carter, who is an associate professor and assistant dean of graduate programs at McMaster University School of Nursing. Our purpose of our NRIG webinars is to really offer opportunities for our members to explore different aspects of nursing research and education around nursing research, and the ways in which to enhance and really find ways in which they can find their way into and be involved in research, whether they're practicing nurses or pursuing graduate studies. And today our focus is going to be around research in the context of graduate studies. So I'm going to hand it over to Dr. Carter, and thank you, and we look forward to hearing from you.
Okay, thanks so much, Elizabeth. I'm delighted to be here to chat about research and graduate school and everything in between. I have shared some slides, and anyone who's looking at this, they're welcome to reach out to me if they want to learn a bit more or if they have questions. And I'll just share with you that the presentations I'm making is based on a presentation I did at the Canadian Association of Schools of Nursing. That was well received, so I've added it, and it's about the same. And I'm assuming you can see my slides.
Not yet.
Oh, not yet. Oh, I didn't share. That's what I didn't do. Okay, hold on. Okay, now I'm going to share.
There it comes.
Well, in the beginning. Okay.
Perfect.
Great. Okay. I do want to acknowledge that McMaster University sits on the traditional lands of the Mississauga and Haudenosaunee Nations and within the land protected by the Dish with One Spoon Wampum Agreement. This is a beautiful picture of the Indigenous community gathering place. It's an outdoor space. We are very fortunate at McMaster to have a Indigenous studies program, and we have a vice dean? I think she's a vice dean of Indigenous Studies, who is a nurse by background. She's a cardiology nurse, I believe, and then she ended up doing a PhD in anthropology, Dr. Bernice Downey. And so we're very fortunate at McMaster. It's a lovely space, and we're fortunate that we have Dr. Downey to work with us and help us as we take seriously the calls from the TRC Commission that have been targeted to the School of Nursing, and we try very hard to incorporate Indigenous learning and cultural sensitivity into our programming. So I'm going to just share a bit about my story briefly. I'm not an NP as advertised on the NRIG announcement about my talk, but I do research on NPs and CNSs, and that's my current research program. So just to share a bit of you about my journey, which is pretty long compared to many of you. When I finished my undergraduate degree, I was quite happy. I was a pediatric nurse and worked in gynecology at Credit Valley many years ago. So that was in the late 80s and 90s. But I was somewhat still liked school and wanted to go back. And at the time, there were not many graduate programs for nursing in Ontario. And like many people in those days, went to Duval College in Buffalo to do my master's degree. And my master's thesis was based on a clinical question I had. I was a pediatric surgery nurse. We cared for all kinds of children, some of which children were disabled. Some children would come from institutions and might not have parents with them. And I had a sense that children who had traditional families and what we might call normal were treated differently post-surgically, especially when it came to pain management, than kids who might have cerebral palsy, that may have different types of disabilities, that may not have a parent with them. And so I had a bit of a hunch, and that's what I ended up doing my master's thesis about, is comparing rates and types of pain medication that nurses give to different children post-operatively. So it was a great little study, and I was kind of jazzed up about it. And um, I had my master's degree, and it opened a lot of doors for me. I was able to get a job or get a position at Hamilton Health Sciences at the time. It was a corporate position doing all kinds of different work around the Children's Health Network, about models of care. And it just one thing led to another. I was able to be a teaching. I got in to do some research, and then eventually I started doing a PhD, not related to pediatrics, because by that time I was no longer working in pediatrics. But certainly, graduate school opened up so many doors and provided so many incredible opportunities for me that I'm a big proponent of encouraging students who do want to go back to school to, or nurses do want to go back to school to do a graduate program. Now, there's so many, what I'm going to talk about today are kind of background informations about going back to school, some specifics about different programs, types of work, and employment. And of course, I'm happy to answer any questions if the participants have any. So really, part of your decision is figuring out what route is best for you, because there are so many opportunities in Ontario for graduate education, and there are opportunities online as well. And I'm going to say, unlike perhaps the United States, the programs in Ontario are all good quality. We have a publicly funded system. We don't have private universities. So they really are all excellent schools that are accredited, that go through, you know, CNO accreditation and are part of the Canadian Association of Schools of Nursing. So all schools are really good. Of course, I'd like to say that McMaster is the best school to go to, but we're very fortunate that there are a number of schools offering great programs and different programs depending on what you do. So it's kind of about thinking about what are your strengths and what is your passion. Perhaps you're early in your career, you're not quite sure yet. Um, so if that's the case, if you go to grad school, you do want to think about not being too narrow and allowing yourself flexibility in case you want to go further or do something different. By the time I did my PhD, I kind of knew what I liked and what I didn't like, and was able to focus my work that way. So preparation at the master's and PhD level, again, many programs with many goals and outcomes. Of course, we have many graduate programs in nursing in Ontario, but there are other courses too that are very relevant to nurses. I'll just speak to about McMaster. We have the Master's in Public Health program. We have a Master's in Global Health, e-health, health policy, all kinds, MBAs, depending what you like. So there might be a better program for you other than a Master's of Nursing. However, I will say that, most graduate nursing programs allow you the flexibility to shape what you want to do and still stay within the realm of nursing, which will be important for you. For instance, if you want to teach in nursing or go further in nursing education. But again, so many programs and with different goals and outcomes. So you can do your homework around that. And typically, if you're thinking of going back to school, the fall is the time when many people have their open houses. So we have a virtual open house. I think we have one a month in September, October, November, December. And I'm sure all the schools do. I'm sure they're all virtual. So you just might want to look on their websites and see, what is Windsor offering? What is, Ottawa offering? What is Queens offering? What's McMaster offering? Typically, deadline for some admissions is January. And this year we know our deadline for admissions is January 30th for graduate school. And it's pretty well the same throughout Ontario. So again, depending on what you like to do, if your focus is really on clinical practice, if that's what you love, that practice, working with patients and families, kind of not necessarily hands-on, but around nursing practice, the best programs for you, of course, the Master's Course-Based Nurse Practitioner program is a great graduate program. If you think you want to move forward with your nursing practice, increase your scope of practice, increase your licensure. And so that is a program in Ontario that is offered in a consortium model by most schools except U of T. They run their own program. So we have a consortium model. The government supports that program, and there are now, I think, over 200 seats a year in Ontario for that. And these are on-campus programs where you get your clinical your clinical experiences in the area that you go to the school. So for instance, if you did it at McMaster, your clinical placements are in the Hamilton area. So that master's course-based nurse practitioner program, if you really see yourself wanting to continue to be a clinician and again, increase your scope of practice, that's a great program for you. There's also our master's course-based programs or course-based programs. Master's course-based programs tend to be the most flexible programs. For instance, if you want to shape what you want to do. So different schools have different specialties. For instance, I believe that Western has a leadership focused master's course-based program. There may be other ones. Now, at McMaster, ours is very generic and flexible. And this is if you see yourself continuing in practice, perhaps want to be a clinical nurse specialist, a nurse educator, work in quality improvement in management or administration. So these master's course-based programs are the ones for you. And I'm gonna share some examples soon. If you want to be prepare for education and research careers and the master's preparation, you're likely going to do a master's thesis program. Um, and these programs prepare you to reach typically. So to do research typically requires graduate education preparation. And of course, nobody does research on their own anymore. I'm PhD prepared and done a lot of research, and I always do research with a team. And so the master's preparation gives you that research experience and preparation to research. But again, you'd likely be working with a team and wouldn't be a lead investigator or anything like that. And typically, master's thesis programs can, of course, have research methods courses, statistics, qualitative and quantitative methods, and you do things like proposal writing, ethics applications, data collection, analysis and results, and you may do funding applications. And of course, all master's thesis programs, you have a supervisory committee, typically that may or may not have expertise because most nursing faculty can supervise someone at a master's level, but methods, preparation, etc. So again, here's just a slide of the example of McMaster, the differences in the program. So I know this is a busy slide, but I will direct you through the columns. So the first column on your left that says master's course, yes, it'll be on your left. It says master's course. So you can see that at McMaster, you take an applied research course. So not that typical specific methods, but it's an applied research and evaluation course. You take a leadership course. You have two opportunities to do a practicum, and that's not necessarily a clinical practicum, but maybe a practicum with a manager, a researcher, an educator, or a clinician. And then you have 4 electives. And at McMaster, those electives can be in a graduate program within our university, or some you can actually take in Ontario, you can take courses at other universities for free if you're in a graduate program. So let's say you come in and you really want to, you have your sights set on being a clinical nurse specialist in mental health. So your electives may be in psychology or clinical behavioral sciences. So you can take graduate courses in cognitive behavioral therapy and PTSD. You can take different things. Your practicums can be with mental health providers, etc. So it's those master's course-based programs that really allow you flexibility. Let's say you come in and you say, I know I want to do something in education. Your electives can be based in graduate education courses within the university. So that's that master's course that allows you flexibility. You don't do a thesis, you just tend to do coursework. It's more coursework than a thesis, but that's why. That next column shows our master's course primary healthcare NP program. And again, in Ontario, that yellow box that shows those 7 courses, those are the courses that all the students, they take similar courses for the NP program. And then they also take some master's courses with our other students. And this is typical of other Ontario schools too. They take evidence-based nursing, applied research and evaluation, a leadership course, and take an elective. Okay, so you can see how that program is very heavily weighted on clinical practice, roles, advanced health and diagnostics, therapeutics, a practicum, and pathophysiology. Okay. So then you can see our master's thesis. That's the fourth or the second from the right. And that's, you can see the difference there. So the courses are quantitative methods, qualitative methods, stats. Again, you take the leadership and the theory practicum course, because when you do research, typically you have a conceptual theoretical framework that you're going to apply to your research proposal, and then that thesis. So less coursework, but that thesis, which you are using your courses to prepare you to write that thesis. And the courses all have, you know, typically have proposals to write as far as the evaluation measures. And then there's that PhD if you want to go further, less coursework, more seminars, usually a graduate philosophy course, some electives, usually research methods electives, and then of course a bigger thesis. Okay, so I'm going to talk now a bit about preparation for careers in academia and independent research. And my expertise is more in academia. And I'm going to get Elizabeth to join in if she wants to comment on working more as an independent researcher or in a perhaps non-nursing faculty. Because we know, PhD preparation is when you have that, you're more likely to do more independent research, you're more likely to be a lead investigator, you're doing original research. But PhDs can be discipline specific. So again, you may want to do, so I shared Dr. Bernice Downey, who works at McMaster. Her PhD was in anthropology. She's an Indigenous nurse and wanted to focus on that. So that was her PhD. But they can be discipline specific. And then of course there's postdoctoral studies. I know some of you think you're done with that, but often now to prepare for a career in academia, you do a postdoc, and I did a 2-year postdoc. So depending on what you're doing, that's something else you can do as well. So I'm going to talk about, because this is a nursing research interest group, I'm going to just talk a bit about the need for PhD prepared nurses in Canada. We do have a shortage of PhD prepared nurses. Qualified nursing faculty is a persistent problem across the field. And currently, currently we know that the nursing cohort of professors continues to age and retire. So typical of the other workforces, I think COVID has, the pandemic has pushed more faculty into retirement. And of course, father time hasn't stopped, so we continue to age. So there is a projected need for more PhD prepared nurses in Canada. Just a bit, this is some numbers around this is a bit old. The National Study and Faculty Survey. It doesn't happen every year. So master's programs, at this time, there was an increase in master's program but graduates, there was increase in enrollment, but only about 640 graduates that year wrote a master's program in Canada, which decreased. Doctoral programs, admissions decreased and graduate decreased. Okay, so there is very small numbers of people who actually go into the PhD program, and not always possible. And I think we understand this. It's as a female dominated profession. We know that um, responsibilities for females are different, and which includes family care of different generations, being the breadwinner. We know that nurses, once they get into the workforce, it can be very difficult. If you've established a lifestyle, it can be very difficult to reduce the work you do. We know from the pandemic that more and more nurses are asked to work overtime, more time, etc. So it is, that's just a bit about numbers in graduate program. We know that, unfortunately, faculty positions, and I'll talk a bit more about that, are not always full-time and not always tenure or permanent positions. Only less than 20% of faculty members in Canada are employed permanently. Now, we don't know if that's by choice or not. And the current permanent faculty age, over half are over 50, 20% are over 60. So it is an aging workforce. And as far as the replacement pool, there's an inadequate supply for the retiring faculty. Okay, so there's not enough people in PhD programs to fill the projected retirement. And in Ontario in 2019, it was projected they need to hire 155 full-time faculty. I don't know how much that has changed. And we just were chatting a bit before the start of this seminar that there are, economic forces that may change hiring of full-time faculty in the coming year or years. We know we've had shortages. Whether this affects nursing programs like other programs and disciplines, I think it might be different because in Ontario, we know that the government keeps asking schools of nursing to increase their enrollment in both the undergraduate and the nurse practitioner programs. So we don't know what what'll happen, but we know that, in Ontario alone had, close to half, oh no, that's maybe a third of the vacancies for full-time needed 65 full-time faculty, and it was only forecasted 1 year that they only would have 17 doctoral candidates in a year. Again, so that's in schools of nursing. CASN information is about schools of nursing registration, so it doesn't account for nurses who might be preparing, doing a PhD in other programs or disciplines. Okay. So what are the roles for PhD prepared nurses in academia? So we know in Ontario, the nursing schools are both at the university and at the college level. Typically, universities are looking for nurses who have both a research and an education focus, and colleges are typically looking for nurses with more of an education focus. There's less opportunity to research when you're working in the college communities, although they do want, they do want to do research. It tends to be education focused research. Not to say they're not doing research, but less of a focus on that. Okay, typical work arrangements for faculty. There is sessional work, and some of you may be doing sessional work right now. Typically, universities, I know at McMaster, we require a master's degree to teach on a sessional, so you may be hired to teach a level 3 PBL course for a term, or you may have a contract to teach something else. We have PhD prepared nurses teach in our graduate program on contract. Then we have, so that's sessional work. Then there's contract work, both full and part-time. So some of those contracts may be a full year, 3-year contract that goes up for renewal after 3 years, allows the organization more flexibility in case of issues of funding, because again, universities are publicly funded by the government, just like hospitals and many other places. So the funding, it can be tenuous, and a lot of times people are hired on contract and not permanently. And then there's those permanent positions, tenure track and teaching track. Tenure track are for faculty who have a research component as well as a teaching component. I'm going to talk more about that. And teaching track are people who typically don't do that much research and have permanent positions in just doing mainly teaching. And we call them at McMaster, we call those teaching professors. So this is what a typical tenure track university professor work arrangement looks like. And you may, there's this kind of 40-40-20. So typically when you're hired as a tenure track professor, you would have a PhD, likely a postdoc as well, to be hired at a university. And 40% of your time would be doing research, 40% of your time would be teaching, and then 20% of your time is doing service, typically for the School of Nursing, but could be service for your discipline, or doing clinical work. So again, so if you think about a work week, that sometimes helps people think about that. But it doesn't go by week, but that would mean 2 days of your work week you should be doing research, 2 days would be teaching, and a day a week you'd be doing service, and that's part of your employment contract. So that could be clinical service. So perhaps you're a nurse practitioner, you have a PhD, you want to teach and do research, but nurse practitioners do have to continue their clinical placement. So, you may have an arrangement with the university where you do clinical work 1 day a week. That could be service. So you might be chairing the undergraduate curriculum committee. You might be in charge of ICAP or maybe you're having or an accreditation, and you're assigned to do that, to lead that work. So that's an example of service to the School of Nursing. You may be the president of the Canadian Association of Nurses in Oncology. So that's a service contribution. It's not an internal one. I mean, the university, the people who are paying your paycheck do want you to contribute your service internally as well. So that's what a typical work arrangement looks like. Now, one thing to think about for nursing positions, if you're thinking about going forward and what you might choose to do, I'm not sure if this is the same for all schools, but many schools would like you to have a PhD in nursing and a master's degree in nursing to teach in nursing. So so at McMaster, for instance, we're looking for PhD prepared nurses with graduate degrees in nursing because we need them to teach nursing theory and nursing research courses and nursing courses and critical pedagogies, et cetera, et cetera. That might not be the same for all schools, but typically it all depends. And that'd be something, depending where you live, you might want to, and you're thinking about this in your future, this might help your decisions. You may live in the London area and think, I would love a professor job at Western or University of Windsor. You might want to reach out, see if you can get some time with the dean and say, I'm thinking about this. What are you typically looking for in your when you're doing your hiring? If I was to do a PhD, what are you looking for? They may say any discipline you want. I bet they're going to say, a PhD in nursing is most helpful. So again, that's typical university work arrangement if you're a tenure track nurse or tenure track professor, sorry. And then here's this teaching track arrangement. And so this is, again, many teaching track positions are hired. And typically 80% of the time you're doing teaching and 20% of the time you're doing scholarly activity, administration, or service. So people in teaching track positions typically are not looking for grants. They typically don't supervise PhD students or master's students. They may sit on committees. They may join a research team, but they're not typically leading their own research. And schools of nursing have a lot of teaching track place positions because of all the teaching that happens in the undergrad program specific to nursing. Okay, that requires nursing people to be nurses and have graduate degrees in nursing. Okay, again, here's that example of administrative service and clinical practice, smaller part. It can be committee chairs, formal appointments, so an assistant dean. So I'm tenured faculty. I'm 50% dean, 40% research, 10% teaching. So sometimes there's different combinations depending on what your academic, depending on different leadership roles, et cetera. Okay. And of course, there tends to be flexibility of work assignments when you're a professor. Early in your career, you might work with your dean and not teach so much so you can get those grants in, establish some research funding so you can bring on students. Or if you have research funding success, sometimes you can not teach as much if you get big grants or you don't often teach as much. And you're always looking for different experiences and opportunities. So again, um, research experience and productivity. So if you want to think you want to be get into academia, things to be thinking about to help you prepare for that. In addition to graduate degrees, having some research experience and productivity. There's postdoctoral work you might want to do. You may want to work with other out at a different university. Get some networking, work with different people, getting some teaching experience along the way, either working as a TA or doing some contract work. As we talked about, maybe teaching a course in the spring term, etc. I think all schools are always looking for contract work. And then getting involved in a school administration. Maybe you want to help with some curriculum development. You may be a diabetic expert and know that they have scenarios in the undergrad, and you might want to say, I'd really like to, I'd like to assist if anyone needs help that can get your foot in the door and help you do, or being part of activities such as accreditation or strategic planning. And then networking, you're all part of the NRIG, which is a great network to belong to. But attending conferences, networking, meeting other faculty, if that's what you're thinking you want to do, or reaching out to researchers if you think you want to do research, but not at the faculty level. Maybe you're not interested in working in academia, but want to do research. There's also opportunities, of course, to work in places like um, in government institutions for different clinical areas. So, for instance, Core Health, which is, I think, changing its name. Many of you may know what Core Health is. Um, they they have scientist roles. Dr. Karen Harkness, who's a cardiology expert and PhD prepared. She works for Core Health and is very involved and uses her research expertise in that capacity. We also know someone who works in it. There are not as many, unfortunately, clinician scientist type roles in healthcare organizations. Unlike medical doctors, there are not as many opportunities for PhD nurses to work in hospital, particularly in, even less in community and other areas, but work in hospital organizations with their PhD and use that preparation. So there's a couple examples. One of our recent graduates from McMaster, Dr. Marissa Bird, PhD preparation in nursing. She's a pediatric nurse. Her PhD was very successful PhD, and she was well funded. She had CHR doctoral funding. Her PhD was related to digital care strategies for children with medically complex issues. And she is working for Trillium Health Agency in Mississauga in a not exactly a clinician scientist role where she's at the bedside and doing research, but she is working and her job is based on her PhD preparation and what she's doing. So there aren't typically as many roles, unfortunately, where there are PhD prepared nurses in organizations doing nursing research at the bedside or inpatient care areas with other nurses, et cetera. That's an unfortunate thing. You see that more in the US, that model, and of course that's the medical model, right? But unfortunately, we don't have to do that. And most of you who are on this call probably understand the pressures on healthcare organizations around funding are probably one of the barriers to that, to um, create those type of roles, which are fantastic not just for patients and families, but are fantastic for nurses as well to have someone like that in a hospital doing research closely. So, and I think that's the end of my slides right now, Elizabeth. I'm not sure. Maybe I'll stop sharing. Okay, stop sharing. There we are. And I'm not sure if there's any questions you might have or anything you think I might want to comment on that people viewing this might be interested in hearing.
Yeah, I think there was one thing that came up earlier, and because it was also kind of my experience in how I came through graduate studies, and I think it's worth commenting on. I think we talk about how if you decide like you want to do research, the MSN thesis based is your best option.
Yeah.
What are some of the challenges or opportunities if someone who did a course-based master's
Yeah.
decides then I want to pursue a PhD?
Yeah. Yeah. Okay, so absolutely it is possible. But probably you need to marry that with some preparation. So PhD is different than master's. And the master's, most faculty in a university can supervise a master's student. There's little, most master's students don't get guaranteed funding, but full-time PhD students do get guaranteed funding. And that funding typically comes from a supervisor. So that supervisor has to agree to supervise the student. So I'll just use myself as an example. So if I'm going to take on a PhD student, I want to make sure they've got research methods courses, some experience in research, and have good writing skills. And of course we have to, seem to be able to work together. So if you have a master's course base, that's an okay start, but it just may increase the amount of coursework you have to do in the PhD. Like if I took on a master's course-based student, I might say, okay, but you have to take qualitative methods, you have to take quantitative methods, you got to take stats before, to start, and you need to work as an RA. Hopefully I have funding as a research assistant, but you need to do some writing. That might be part of the deal, because you have to hit the ground, you have to, within most schools, they're full years, it's full time. If you're doing it full time, you get funding. If you're part time, you don't get funding, but then it drags on. Like, I get it. When I did my PhD, I had a little one, and you know, my husband and I were both underemployed, and I did it part time, but if I could do it again, I don't know if I'd do it, but I did it. So it's a big commitment, so you don't want to take forever to do it. So I think I get it that it's not always possible, but if you doing the master's thesis keeps your doors open and makes it easier later for you. You've got perhaps a publication, you've got relationships, you've got the coursework, because all those things that you have help you to get more funding when you're doing a PhD. It's at the PhD level where there's the big funding. So there's national funding awards, CIHR, SHRC, Vanier awards, and I know at our university, students are very successful in getting those, and I'm sure at other universities as well. Um, but you have to have, you have to, if you'd apply for that, having done research, having a couple publications of your own research, first author publications, that really helps prepare you. Again, you can do it without, but it makes it a bit harder, because at most universities, you have to do a comprehensive exam, which is a proposal, it's a defense. You got to be writing up your methods quickly and you got to know what you're doing. So that is very helpful. A master's, you know, if you do a master's thesis, you still get a master's degree. You can still apply for that CNS job, that educator job, that other manager position. It is a bit tougher, but they can both be done in 2 years full time or 3 years part time.
Right.
So, but it really depends what you want. You may know right now, I love clinical practice. I want to be an educator, or I love to work in QI. Master's course might be the one for you. But you know, if if by chance you think, but then eventually I want to do a PhD, do the master's thesis. That's a great question.
Yeah. Yeah. And do you mind if I add something
Yeah, please
to
do.
that too? Is like, I know, mind you, and some of my experience, I will just preface, has been in the US.
Mhm.
And so I've experienced this with a lot of US based folks as well, around folks who've been, for example, in a CNS role or a nurse practitioner role as well for, a decade, 2 decades, wanting to come back, like that there is value. And I think I will say we need more nurse practitioners who are
Absolutely.
PhD prepared.
Absolutely.
We need that.
And CNSs, absolutely. Yep.
And CNSs. And I think, yeah, it's like you said, there may be some upfront work that has to be
Yep.
done
Yep.
to kind of get you to where you need
Mhm. Mhm.
to
Mhm.
be.
Mhm.
I will say, and I did a course-based master's with a like capstone project, which
Yep.
I did an integrative review. So I'd
Okay.
done some like knowledge synthesis work ahead of time. But when
Great.
I got into my PhD, I had to take qualitative methods and stats
Yeah.
in my first
Yeah.
semester.
Yeah.
Um, because those were prerequisites for the advanced
Right.
methods
Right.
courses that I would take
Right.
in my
Exactly.
PhD, which was
Exactly.
not in Ontario, but still.
Right.
I think a
Yep.
lot of schools are very much
Yeah.
like that and also to say, like, if you're not sure what you want to do, even if you're doing the course-based masters, if you think, oh, maybe research down the line, at least if you don't feel like you can do the thesis at that moment, use your electives to take
Take research
the
courses.
research
Absolutely.
courses,
Absolutely. Absolutely.
because that would make I think that'll
Yeah.
make a huge
Yeah.
difference
Yeah.
in terms of that. But also I will say, for something like statistics, after about 5 years, you do lose it, or even less than that if you're not
Oh
a
yeah.
stats mind.
Absolutely. Absolutely.
So just because like, just if you're not gonna do your PhD in the next few years, you may want to just retake stats.
Yep.
On the side or like just brush up on your stats again before
Yeah.
you come into
Yeah.
programs. And there's increasing numbers of graduate programs. I've seen a few across the country who have actually started integrating statistics refresher modules coming into their graduate programs.
Great idea.
For BSN prepared folks, especially coming into
Yep.
master's programs, just because as nurses, that's just like, there is a huge fear of statistics amongst undergrad nurses. I'll admit that.
Absolutely.
So.
You've raised something that I should talk about too. So because because I'm in my role, I'm in my 8th year of being the assistant dean. So I'm used to doing a lot of open houses and, orientation sessions. So if you're a nurse who hasn't been to school in a long time, you think you're ready for a change, but your BSCN was a long time ago. Oh, I mean, you do need academic references to get back into school. So you do need faculty who have evaluated your work to vouch for you. So for some people, that's difficult. The other thing that may be difficult is the thought of going back to school. Getting your brain back in gear. Maybe you've had a couple kids, or maybe it's been a long time and you've been caring for other people, or whatever the situation is, getting back into gear. Most schools, and we've started encouraging students to do this at McMaster more. At most schools, you can take a course or two in a graduate program. It's called postgraduate application. So we've started doing that more, and we've had a couple students. It's worked very well. We've had a couple students who have either to get references or to get warmed up. Or because they know it's hard to take so many years off work, they may take a couple courses as a warm up. Take our qualitative methods course, for instance, or take our leadership course. So they both get their head back in the game and writing and that. They may get those research courses that they may not have had, and they get references. Now you do have to pay. It's not that full tuitions, but you do pay. And then at McMaster, those courses, if you take, I think up to 2 courses can be used towards your degree. So if you take them, we have a student, she took methods in another course. She's now started the PhD, and she's got those 2 under her belt now. It's lessened her load. So that's an opportunity for you as well. And I'm sure most schools do that. It's McMaster, it's called post-degree admission. You can take the nursing, you let us know, take the nursing courses, so that if you're near a school, again, if you're in Windsor and up in Ottawa or wherever you are, you may want to reach out and say, is there that opportunity for me? Can I do that? Yeah.
Yeah. That's really important and helpful, because it is a big, if you have been out for a while, it is a big transition.
It
not
is.
not just transitioning to graduate level studies, but transitioning back to the mindset of learning differently than, like, we're all lifelong learners and are always focused on learning in our practice, but it's different
Oh
than
yeah, absolutely.
than
And
being in grad studies. And it's also worth, doing reading and writing before you come in. Get yourself back into the groove of writing in a different genre. As nurses, if we write narrative notes, that's not the genre of writing that we do in graduate programs.
Picking up some, whatever you are. If you're an oncology nurse, Journal of, Oncology Nursing, just start reading some articles and get used to, okay, this is what I'm going to be doing. This is what or whatever it is. Now, the other thing too is, getting ready academically, but also getting ready lifestyle wise. Like I always tell people that one, it is a sacrifice to reduce your workload and go back to school. It can be a sacrifice for you, for your family. It can be financial hit. University doesn't cost that much. Wages have been, or tuition's been frozen by the Ford government for years, so it's not like in the US. So it's not the financial, I get it costs. The financial cost is not as much as having to reduce your workload. I tell people it is almost impossible to work full time and do even a part-time degree. You have to be ready. So you have to think ahead. Okay, at some point I'm going to have to not work as much if I want to do this, but then also getting ready mentally. I actually had a grad student do a placement with me, and we did a lit search about nurses transition to graduate school. It's that being that expert in cardiology and then going back to school and not knowing anything, right? Or
Yes.
learning everything new. And it's like, oh God, what am I doing this for? And just that personal feeling of not knowing and learning new things, et cetera, being a fish out of water, all those kinds of things. So that's another thing to just be prepared for to do it. But again, so worth it to just create opportunities for you. I don't want to discourage people, and I try not to do that at our open houses, but I want people to be realistic. I want them to think about that this is, that for, I always tell people, don't host Thanksgiving next year if you're going to do this. Don't plan a destination wedding next winter if you want to go full time back to master's nurse practitioner.
Mhm.
It is a commitment, but so worthwhile. And again, so many there's schools that are everywhere, and certain schools have, the other thing to think about is certain schools have certain expertise, like Western and University of Toronto are experts in education.
Mhm.
We at McMaster, we're into research and have a lot of expertise in advanced practice nursing research and aging and palliative care and digital health.
Mhm.
Ottawa has knowledge translation and different things. So
Yeah,
different schools, Queens, if you're into simulation, they have fantastic work on simulation.
yeah,
They do leadership stuff. There's the schools are great in Ontario, and the schools have different people, different faculty with different expertise. So yeah.
yeah, absolutely. And just to add to that list, for folks who are really equity oriented,
Yes.
places like York, Toronto
Yes. Yes.
Metropolitan,
Yes.
Western as well, is getting
Yes.
there
Yes.
around equity focused
Absolutely.
work. And I particularly Western or York is very diverse in their
Yep.
the amount their kind of research related to
Yep.
equity
Yep.
and inclusion that
Yep.
comes from
And
faculty in
right.
in those
Yeah. And I think
programs.
York and Western both have affiliations with international schools too. So maybe you're interested in
Yes.
global health. York has an affiliation, I'm pretty sure, with the School of Nursing in Ghana. TMU,
Yes.
again, you're right. Former Ryerson University has fantastic Dr. Erin Ziegler. She's
Yep.
a nurse practitioner. She's PhD. She does research. She teaches.
Yeah.
She's
Yep.
very interested in the trans community.
Yeah.
She's doing
Global.
it all. You
Some
know.
they have Toronto Med has some amazing global health scholars
Yep.
as well
Yep.
as
Yep.
um, a very unique PhD program in urban health.
Yep. Yep.
So there's a lot of creativity
Yeah.
happening
There is. There
within
is.
different
There is.
schools of nursing
Yeah.
and or faculty of health sciences
Yeah.
broadly
Yeah.
within
Yeah.
these universities.
And for PhD studies, you can bring faculty from other disciplines onto your committees or from other schools, right? Like, and that's
Absolutely.
that's where you can, maybe you can't relocate to Kingston to go to Queens and have those experts in simulation, but you could do a McMaster PhD, and you can bring on a Queens faculty member to on your committee. So
Yes.
there's a lot of flexibility because we know that people, we know a lot of nurses and women are, I don't want to say landlocked, but location locked and can't necessarily pick like a typical science PhD wouldn't pick up and move to another university. 'Cause we understand that. So there is more flexibility. And some programs, now we're not an online program, but there are some, I think Queen's PhD is online. There are more master's online programs. So
Yeah. And
lots of different opportunities for nurses.
yes, absolutely. And yeah, I would definitely, yeah, lots of different opportunities. I was going to say something else and now I forget. It's already gone.
That's okay.
It's already gone, um, but yes, and like there are more online opportunities or even some more hybrid
Yep.
options where you may
Yep.
be asked to go from even for your
Yep.
master's, go for like a week or two a year,
Yep.
like a
Yep.
2 week summer intensive
Yep.
and everything else is
Yep.
done virtually.
I think that's Queen's program. Yeah.
Queens, and I think there's there's something at Western, I think that
Yeah.
does that as well.
Yeah. And Windsor offers online courses. So for instance, PhD, not all PhD classes are big.
Correct.
You saw the numbers. So sometimes our intake is 5 students in a year.
Right.
And so sometimes all the schools we work together. So sometimes our students will take the philosophy at Windsor from McMaster, an online philosophy course,
Mhm.
for instance, and join another cohort because it's always fun I always think it's better if there's 10 of you in a class at least so you can learn more. I mean, that's the part about graduate studies. You are responsible for contributing to other people's learning. It is active, it's smaller classes, it's leading seminars, it's you sharing your work, it's, you know, that kind of thing. So it's nice when you have a bigger cohort as opposed to just a few people. So
Yeah, definitely. And I remember what I was going to say, 2 points, just to go off of what we talked about around having committee members from other universities.
yes.
I did that for my PhD. I had an occupational therapist by
Yes.
clinical training on my committee. And I chose that for a very particular reason, to have a different disciplinary perspective, because for the focus of my dissertation, a lot of the theory that I was drawing on wasn't something that nurses do a lot with. And so I wanted someone I know has been doing that work.
Mm-hmm.
And also, just to speak a little more to interdisciplinarity, when doing a PhD in nursing doesn't preclude you, one, from taking courses in other disciplines that may
Right.
help supplement, and then
Right. Absolutely.
I highly encourage it. But the second piece too is if you want to do if you're going to do a postdoc, there is nothing that says you have to do your postdoc in nursing.
No. No.
And in fact, there is a lot of value in not
Yep.
doing it in
Absolutely.
nursing.
Absolutely. Yeah.
And then coming back and really inserting yourself into those really deeply interdisciplinary
Yeah.
spaces.
Yeah.
I chose to do my postdoc outside of nursing because nursing didn't give me the language I needed to work with the ideas
Mm-hmm.
that I was working with around disability. And so I found
Right.
an interdisciplinary social sciences and arts-based space that
Mm-hmm.
has allowed me to really enhance my methodological training. And then
Right.
I'm now able to bring it back together with nursing
Right.
in unique ways. So I would just say with nursing, there are so many possibilities.
Yep. Absolutely.
And
Absolutely.
and I so like the hardest, I'll be honest, half the time the hardest part is figuring out what direction
Yeah.
you
Yeah.
want to go in if you
Yeah.
want to do research. So
Yeah. That's great.
yeah. So I think if there's nothing else you wanted to say, Nancy, I think we
Okay.
can end.
There isn't. I didn't. If you share the slides, you're welcome to share my McMaster email. If people want to reach out and ask questions, be happy to chat.
Yes.
To share, thoughts or ideas. Again, great schools in Ontario, great schools in Canada. Think about McMaster. We'd love to have you here if you want to do research. We're very research intensive, but wherever you are, there are great schools. So, okay.
Wonderful.
So thank you for the opportunity.
Thank you for
Okay.
being here.